Inside your body, there are the receptors for the cortisol hormones, and they are distributed almost every part of the body. Like they are involved in the bone formation, they are in the brain, and they are in the gut and other part of our body as well. Blood vessels, you can say. Now, as this cortisol is involved in the activation of the sympathetic system. When your body is under stress, this hormone causes the activation of sympathetic system. So the symptoms that are produced by this hypercortisolism, they will be related to the activation of the sympathetic system and the suppression of the parasympathetic system. So you can now conclude what can be the condition of the patient when he or she is suffering from the hypercortisolism. So let's study these symptoms one by one. First of all, let's see its impact. It's a psychological impact. Now, when there is the condition of the stress, obviously it is going to affect the brain, the way the brain is working, the release of the neurotransmitter and the passage of impulse. All of these things will be affected, and these causes will lead to the symptoms like depression, anxiety, irritability, loss of emotion control, and cognitive difficulties. So the patient who is suffering from the Cushing syndrome may experience such psychological symptoms. Also, the desire, the libido will be decreased. Now, what is the impact of the cortisol hormone on the vascular system? If you recall the normal physiology, you can know that the cortisol is involved in regulating the blood pressure, not in the normal way, but when the body is under the stress and the sympathetic system is activated, this cortisol basically tend to constrict the blood vessel. It constricts the blood vessel so that the blood oxygenated blood supply increases. Now, because of this constriction of the vessel, what happens that the blood pressure increases. So in the case of the hypercortisolism, patient may suffer with a new or worsened high blood pressure. Like if the patient is not a high blood pressure patient, he may get this disease, or if he is already a patient of the high blood pressure, then the blood pressure level may even worsen. Then bones can be affected by this cortisol level. Now, how in the bones you can see the increased risk of fracture. Now, this increased risk of fracture is because of the osteoporosis. Now, osteoporosis is a condition that basically softens the bone, and it is due to the decrease in the osteoblast. Now, what is going to happen because of the hypercortisolism? There will be the decrease in the osteoblast formation, and because of this decrease in osteoblast formation, bone formation will decrease. The bones will undergo osteoporosis. That's why the risk of the fractures will increase. Next, there will be the reproductive system will be affected. Now, how reproductive system will be affected? Now, as the body is under the stress. So, in case of the female, the menstrual cycle will be affected, the conception and the fetus, the uterus conditions will be affected, and in men cases, there will be the erectile dysfunction. So, the patient may suffer with the irregular or absent menstrual periods, or there can be the erectile dysfunction in case of Cushing syndrome. Then there can be some generalized symptoms. Now, these generalized symptoms can be also because of the activation of the sympathetic system. Like there can be the weight gain. Weight gain, as I told you, can be due to 2 or 3 reasons. Like at first, it is because of the distribution of the fats to the visceral parts of the body. Like the fats that are deposited under the deep layers of the abdomen, under the deep layer of the muscles, they are distributed to the visceral parts of the body. Second, there can be increase in the appetite. Now, this increase in appetite is because the body is under the stressed condition. There is decreased level of the insulin, and there is the glucose that is being produced is rapidly consumed. The cells feel that they are deprived of the energy, and this signals the brain to produce more and more to eat more and to produce more cortisol, and the patient feel hungry, and that lead to the overeating and overweight. And Other things can also lead to the increase in the weight of the patient. Then there can be the slow healing of the cuts and wound. Now, this slow healing of the cuts and wound may be because there is the decrease or suppression of the immune system. Now, this suppression of the immune system is because the cortisol always tend to cope up with the inflammatory condition of the body, and it tend to decrease the inflammation quickly. Now, when it is trying to suppress the inflammation, it also suppress the immune system. That's why it can be a reason of the slow healing of the cuts and the wound. Then, as I told you, weight gain. In weight gain, I was telling you that there is the suppression of the insulin, and there is the quick use of the glucose, or that will also lead to the diabetes. So the patient who is suffering from the Cushing syndrome may also suffer from the diabetes. That is due to the suppression of the insulin. There is almost no insulin, and the glucose level is high inside the body. And also there is a breakdown of the protein in order to produce the glucose and energy. So all of these things are supporting the high level of the glucose inside the body that will lead to the diabetes. Then there can be the increased risk of the infection. Now, again, the immune system is suppressed, so this will make the patient more prone to infection. There will be the increased risk of the infections. Then fatigue, the patient may suffer from the fatigue, and this is also because of the decrease in the energy, and the cells, the stress system is activated. That's why the patient feels fatigued and lethargic. Then there can be the glucose intolerance. That is also due to, as I told you, because of the decrease in the insulin level and the overproduction of the glucose. Moreover, there can be the headache, there can be the moon phase. Now, moon phase is the most prominent clinical presentation of the patient who is suffering from the Cushing syndrome. What happens that in case of the Cushing syndrome, the fats are deposited at the site of this skull. When the fats are deposited at the site of this skull, what these face become more round, that is known as the moon phase, and it is the most prominent symptoms of the hypercortisolism. There can be the buffalo hump that can be seen in such patient. If we talk about the muscular system, there will be the weakness, and this weakness is also because the proteins are being converted to the to energy. There is the consumption of the deposited proteins, and also the glucose is not being stored there. The stored amount of the glucose is being released to cope up with the energy body need. So that's why there can be the muscular weakness. Moreover, if we talk about the skin, there can be the thinning of the skin, the fragility and acne can be seen, hirsutism can be there, and the stray can be present, as you can appreciate here. So these are some symptoms that can be seen in the patient. Being the prominent one is the moon phase, the Cushingoid appearance, and the fatigue, the depressive symptoms, and the weight gain. These are some most prominent features that you can notice in the patient, and you can conclude that he or she is suffering from the Cushing syndrome or hypercortisolism. And then obviously you will move toward the diagnostic test. You will take the laboratory test and check the level of the cortisol hormones, and that will tell you that if the patient is suffering from the Cushing syndrome or not, and then you will move on toward the treatment. So that was all about the hypercortisolism.